Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. For this procedure, I'm actually showing you the contents of the extraction right from the beginning on the offset, so you can gauge what the procedure may have been like. You can see we've used an array of instrumentation ranging from microsuction with the Zollner suction probe and St Bart's ear hook and also a Jobson horn. So this is the patient's right ear, and I've just gone in with the Zollner suction probe, but you saw this consistency of wax. It's very clay, mud type, and the Zollner suction probe wasn't going to extract that. Instead, all it served to do was make an imprint onto the surface, the lateral surface of the wax. This patient's ear canal is very, very narrow. Just a bit of a background with the particular patient. They have to have their ears cleaned out regularly. They're only a young patient actually, and they used to see a particular ENT consultant who has since retired. And with the patient, they've obviously they should have had their ears cleaned far sooner, but they were in the process of trying to find someone that they feel that they can trust. And I can kind of understand that from the patient's perspective. We've got a lot of clients who come here and they don't, once you develop that rapport with the client, they don't want to go anywhere else. So the patient was very nervous, anxious, and she saw me on YouTube and decided to travel down to my clinic in Leicester, which is in the Midlands, so the centre of England. And she's very, very, very nervous. And she explained that the reason why is because she's fully aware that her entrance of the ear canal in particular is very narrow, twisty, and it's always quite a complex procedure. So just using an ear hook, I'm slowly just extracting this soft wax, slightly matted. You can see there's a few hairs there. And there's also a bit of keratin involved. And we're just bringing this slowly but surely forwards. And it is a bit tricky just because you can see how narrow this ear canal entrance is, and that is probably a contributing factor to her wax buildup. So why do people develop wax buildup? So the ear itself, for the majority of people, say between 90 to 95% of people, the earwax comes out naturally, and that's due to the epithelial migration. If you watched my video yesterday, explaining in great depth the epithelial migration, so the skin that lines the ear canal, as it dies and sheds, it moves sideways and outwards out of the ear like a conveyor belt, and as it does, it takes with it any earwax. Earwax should only be secreted on the outer third. So reasons as to why people develop earwax. Now, it could be that the skin doesn't shed and migrate like a conveyor belt. They've lost that mechanism. I'm aware that people who have undergone radiotherapy treatment do sometimes lose the ability to shed their skin in the ear canal sideways and outwards like a conveyor belt. So quite often you get patients who've had radiotherapy treatment and they develop earwax impaction. If you've got a narrow, twisted ear, if you think about a river with loads of bends, as it meanders around the bend, it deposits some of the heavy rocks. I think it's on the near side. Same with the ear. So as the wax is going around the bend, it's travelling probably a bit faster on the outer part of the bend as opposed to the inner part, and the wax can get built up on that near side of the bend, and then cause a blockage beyond that as well. Some people secrete wax a lot quicker than the ear can naturally expel it, so it's just a natural build-up. So the earwax does come out, the migration system of that epithelial skin layer is active, it is operational, however the ear just simply secretes wax much, much quicker. Sometimes people have a lot of hairs at the entrance of the ear canal. That can sometimes mat with the earwax. I'm kind of thinking that's less of a reason now, but in theory, of course, you can just imagine a lot of hair and it can mat, just like with this patient. She has got a few hairs. If you've got a narrow entrance and narrow twisty ear, obviously this wax is just going to get trapped during that narrowing. If you've got any abnormal widenings in the ear canal or trenches, craters, the skin, as it migrates, it goes into the trench or crater and it gets trapped. So if you've had also a mastoidectomy, so your mastoid cavity, the bone at the back of your ear canal is drilled out, it widens it, and you can often get skin and wax build up there. Of course, if you use earbuds or hearing aids or cotton buds, they can all push wax, or if you wear ear defenders or sleep plugs or swim molds, these are all things that can push the wax further into your ear canal. I think there's quite a few reasons there already. If you've got very dry earwax, kind of more elderly patients, it adheres to the ear canal skin, you get friction so it doesn't migrate. Conversely, if you've got very wet earwax, slushy, wet, clay type of earwax, it sticks to the ear canal wall. So there's kind of multiple reasons there. I'm sure there's many more. I hope you enjoyed that video, guys, and you're all having a great weekend. Thanks, bye.